The pain shield therapy device consists of three components. The first is the driver, which sends the electrical current to the active therapeutic pain shield patch. The second is the green wire that you see here that connects from the driver to the device. And it's very important that one understands the anatomy of the pain shield therapeutic patch. There are two buttons that connect to the driver with the green wire, and then within the patch you can feel that there are two electrical wires that run from the buttons to the actual metal plate under the patch, from which there is the therapeutic effect. The therapeutic effect comes from this metal plate. It comes mostly from around the metal plate, not under the metal plate, so we always make an effort to place the metal plate right next to the site we want to treat, not necessarily over. But there is a wide dispersion effect of the treatment as discussed previously. What is important to retain in this segment is the notion that the patch is often too big to be comfortably applied to the site that hurts, particularly if that site involves the face or a small corner of the body, such as around the toes or around an elbow. In that case, it is permissible to cut down the patch to its bare functional minimum without losing any of the functional qualities of the patch. And that could be done very simply by cutting across this line, as well as this line and this line, which gives you a reduced size patch. The only disadvantage of reducing the patch to this kind of dimension is the fact that the patch was designed to hold on to the body through an adhesive. And once one does that, the adhesive potential of the patch is greatly diminished, and one has to resort to Cobham athletic wrap dressing in order to hold the patch onto the body. 3M Cobham athletic wrap dressing is a dressing that is elastic, well ventilated, and sticks to itself without glue or Velcro. If one wraps the dressing around the pain shield therapeutic patch and around the limb, whether that is, by the way, the face, the head, an arm, or leg, one will find that it adheres quite well to the body without being sticky. It can be wet and doesn't lose its grip, and it's breathable enough to not cause the therapeutic ultrasound patch to overheat. So this is the recommended technique for holding the ultrasound patch to the body, especially when the patch has to be cut down in size in order to be able to fit comfortably on the treatment area. The tremendous advantages of this new Israeli surface acoustic ultrasound technology is that we can apply the decades-old concept of phonophoresis, that is, using acoustic waves to mechanically drive medicines from the surface of the body into the tissues over a much broader surface area. It used to be that phonophoresis could only be carried out from under the ultrasonic transducer, whereas now the ultrasound patch produces a wide field of about 20 centimeter diameter of surface acoustic ultrasound. This means, for example, that if we develop a compounded pluronic gel that contains medicines useful for the treatment of pain or the reduction of inflammation, in this case, this is a gel containing 20% ketamine, 5% amitriptyline, 5% gabapentin, 5% carbamazepine, all of which are drugs that are highly effective in the treatment of trigeminal neuralgia, but that can produce problematic side effects. We now compound this drug into a solution, and we could take a small amount of that gel, rub it on a surface area such as the face, and here, just for demonstration purposes, I'm going to put it on the hand. And when I apply the ultrasound patch anywhere on the hand, I get a 20 centimeter field of surface acoustic ultrasound, whether, of course, this is on the hand, on the face, or on any other area suffering from severe neuropathic pain. We now have randomized controlled clinical trials showing us that topical ketamine, for example, is highly effective at reducing allodynia. And there are many clinical trials showing that topical nonsteroidal inflammatory drugs can also be effective in reducing pain and inflammation. However, all of these drugs have potentially serious side effects. By compounding these drugs through a skilled compounding pharmacist in your area, or by ordering them through us and applying them to the area of pain, we often find that there is a tremendous synergy between the analgesic effect produced by the ultrasound itself as well as the medication effect driven via the ultrasound phonophoresis effect into the tissues. This has been particularly remarkable in trigeminal neuralgia, where we have clearly seen a strong synergy between the ultrasound effect and the effect of topical analgesic medication.